everyone, my name is Pooja Prasad. Today I will be talking about simple yet very important topic, that is why is it important to take a blood pressure measurements at home. Have you ever wondered why doctor asks their patients to take their blood pressure at home instead of just relying at the clinics? According to American medical associations, there are 50% of adult population in the United States that suffer from high blood pressure. It is also known as a silent killer as it doesn't have any obvious symptoms until it's too late, until the patient has already suffered stroke or heart attack or kidney diseases. As a future nurses, is it upon us to take that initiative to teach the patient why it's important to take their blood pressure at home. All right, in this speech, I will talk about three main things. First, why is it important to take your blood pressure at home? Second, how to properly do it. And third, how to record and notify the healthcare provider. Let's dive into the first one. Why is it important to take your blood pressure at home? It is simply because a lot of the people, including myself, suffer from what is called a white coat syndrome. That means people are too nervous when they're at the clinics. That causes them to have a high blood pressure. When they take it at home, it helps create a baseline. It helps create to know what is their baseline blood pressure. It helps recognize the trend so that it helps healthcare provider to formulate an effective treatment plan. It also encourages patients to actively take a part in their care. That encourages people to do lifestyle modifications which is needed to control the high blood pressures. It is also likely that when patients are actively participating, they are likely to call the provider on the early signs, which helps provider catch an early diagnosis rather than when it gets complicated. All right, we know why it's important. Let's move on to how to do it. Accurate reading entirely depends on the perfect techniques. Patients should rest at least 5 minutes before taking those blood pressures. Their both feet should be flat. Their back should be supported. They should not drink coffee or smoke at least 30 minutes prior to taking the blood pressure. Another thing to watch out is blood pressure cuff. Patients should have a proper size blood pressure cuff. If it's too big, too small, it will create inaccurate readings. The blood pressure cuff should be placed on their skin, not on top of clothes, and it should be on the heart label. All right, now we know how to do it. Let's move on how to record and notify providers. Recording is easier on these days because of the development of technology. A lot of the blood pressure machines record the readings for the patients and send the information to the healthcare provider directly. But if that option is not available, a patient can simply create a log, write down the time, write down the date, write down the reading of the blood pressure, and any pertaining notes, such as if they were feeling anxious when they were taking blood pressures, or if they had taken any medications while taking those blood pressure, and simply bring those log to the doctor's visit. If they identify any abnormal readings, call the doctor office and let the provider know so that provider can catch it early on. All right, we know why it's important, how it's done, and how to record it. Let's wrap it up. Taking blood pressure at home is not just a routine thing. It is very critical to promote the long-term health for patients. As a nurses, we should be able to teach patients why is it important for them to take their blood pressures at home. By doing that, we not only help patients actively participate in their care, we promote their health, we promote patients taking charge of their health, and we basically save life. Thank you for listening. Bye-bye.